Okay, so hi everybody, and thank you for coming. My name's Emily. I am a student at McKendree University, and I am in my final course for the practicum, so I graduate on May 11th. Yes, I'm very excited, just a couple more weeks. So this presentation is for the final class, like I said. The course is Leadership and Management, and I wanted to do something that was not only going to apply to this class, but to also benefit us in the education department. So as all of you know, I'm a tele-educator and been working very close with everyone with Skills Days recently. And so Amanda Ernst is my preceptor. She was so kind enough to help me out with that. And we got together and talked about some different things that we could do for this project. And we thought that Skills Day would be a good thing. So I'm going to be talking about the effectiveness of clinical skills days. So what are skills days? I know this is kind of going to be a refresher for everyone. Most of us already know what skills days are, but they provide educational information on selected topics, procedures, and equipment. It allows time for the staff to have hands-on demonstrations with equipment and procedures and things like that, and it also allows time for questions and concerns to be addressed. So we know that the nursing field is constantly evolving. There's always new guidelines, new equipment, new procedural changes, new policy changes, and we're always finding out new things with evidence-based practice. So with these changes comes the need to educate and ensure competency of all nurses and nurse assistants, which will increase patient safety, provide optimal patient care, and increase our compliance with policy and procedures. And of course, we never want to cause any harm to our patients. So this kind of ties into that. So stations are set up and instructed by a nurse educator, a leader, or a clinical RN. Completion of all stations typically takes an hour to 2, just depending on the volume of people that are at the skills day. So general skills days are mandatory for all colleagues. ICU, ED, and OB have special skills days for their colleagues to attend in addition to the general skills days. And now we've just added the tele skills day, which was very successful. We had 132. So that was great. We offer these skills days biannually at HSHS hospitals. And as I previously mentioned, they are mandatory for all nurses, nurse assistants, PCTs, nurse externs. Compliance with skills days is monitored by staff development. Carol Ann helps us out with that. She scans everybody when they come in. So why do we do these skills days? So as I mentioned, we want to ensure competency of all colleagues. We want to educate or refresh staff on new products, equipment, or policies, and competence is a core value at HSHS. So we all know how important that is to us in this facility. So I have a little insert here from Claire Price Dowd. She described competence as the very essence of being a nurse. It's about being professional, having the right skills, behaviors, and attitudes to perform well. And it also gives our patients and carers the confidence that you are supporting them in their health and healthcare choices at all times. So I really liked that, and it really made me feel good. So another reason why we do skills days is because we always want to improve on our clinical skills. And the bottom line is that we always want to provide the best possible care to our patients. So what are some of the benefits of hosting skills days? So we are able, for education, we are able to educate a large number of colleagues at one time. It's a little bit easier to facilitate the education process rather than going around from colleague to colleague. As you know, that would take a very long time, especially at a hospital like St. Elizabeth's or Effingham, where we have a lot of colleagues. It's a little bit more personal than doing education in a large room or an auditorium. So like in a lecture setting, it's a little bit more personal than that. We can be more effective than assigning computer-based learning or CBL's health stream activities to colleagues. So some issues that we know with CBLs is that individuals can rush through the education without having a good understanding of the content in the CBL. They don't allow the colleague to ask questions if the learner is uncertain or does not understand the topic or a certain aspect that's being presented. So something that I kind of thought of was it would be pretty hard to teach a colleague how to access a port through a CDL, I feel like they would retain that information a little bit better if it was a hands-on like we do. We've been doing it the Skills Days this year, and also in the past. So Laura Moore reported that the use of an online independent learning module as the only strategy may not necessarily be the most effective method for teaching evidence-based knowledge and skills to nurses. So as you'll see later in the presentation, that's kind of how a lot of people reported that they would like to receive their education, but we know from this literature that that is not the most effective way. So continued benefits of Skills Days. So colleagues appreciate having the interaction with the unit leaders and educators. I know I had a colleague come up to me after we did the Tele Skills Day, and it was one of the lunch and learns also, and they were like, you know, I really hate to have to leave the floor and leave my patients, and it disrupts my workflow, but I always really appreciate it afterwards, and I get a lot of benefit out of this. So I thought that was great. I love to hear that. The information can be presented. The information that's presented may not always be new, but as I just mentioned, staff appreciate and value having a refresher on that topic, especially if it's something that they haven't done in a long time. The staff has the opportunity to be hands-on with equipment that they have never used or with a process that they have never been assigned. So examples include ultrasound for the peripheral IV insertion. We've been using that at the Skills Day so far, and that's been a good opportunity for people to get that hands-on with that, and I know a lot of people haven't used it. So Portacath access, PureWix, utilizing MCN to look up a policy and looking up our safety data sheets in MSDS. So these folks here, Zamora, Clark, Winslow, Schneider, and Burkhardt said that simulation scenarios help nurses think and act critically without harming a live patient, thus experiencing an increase in knowledge which promotes better patient care. And I kind of included this at the top here. I just liked it. So employee satisfaction. So we set goals, we surpass them, we celebrate and repeat. So I liked that. Thought that was good. So some disadvantages of Skills Days. So these are some things that I found in the literature, as well as some colleague comments that I had heard throughout the last couple months. So, you know, colleagues, in order to do the Skills Days, they have to come in on their day off to complete the Skills Days. So that can cause issues like if they need to find a babysitter or if they have other plans. Due to large volume of individuals in one room, some may have trouble concentrating or staying engaged at the stations. So the noise level can be a little distracting there. The topic may not be applicable to some attendees' units. So I know at the Skills Days that we've been doing so far, we had a lot of OB colleagues at Effingham, and we had the port station. They're like, we never do anything with ports. So, I mean, it's a good refresher. You never know, but it's not really applicable to them. Some night shift colleagues may have to attend after their 12-hour shift has ended. So as we know, fatigue can lead to difficulty focusing on presentations or education. So are biannual Skills Days effective? So throughout the HSHS divisions, Skills Days are biannual, like we talked about before. The hospitals are required, our HSHS hospitals are required to do the ones that are also specific to their unit. And then float pool colleagues must attend all of the Skills Days. So that is a requirement. The goal of this project is to determine if colleagues find biannual Skills Days effective in learning how to use new equipment, learning a new process, or to be refreshed on a topic that they are already familiar with. So the additional goals that I wanted to identify were finding components of Skills Days that require improvement, and then areas that we are doing well and are well received by the staff. So in order to get this feedback from the colleagues, I sent out a Survey Monkey through email. All right, so the survey. So the Survey Monkey was sent out to about 150 colleagues at St. Anthony's Effingham, St. Joseph's Hospital in Highland, and Holy Family in Greenville. And the survey included the following questions. So there were 7 questions, and the first was, do you find biannual Skills Days beneficial? Do you feel that the skills covered at Skills Day events are applicable to your practice? Did you gain a better understanding of the topics that were presented at Skills Days? Did you feel engaged during station presentations? Were your questions or concerns answered? Did you feel that the information was presented in a sufficient amount of time? And how would you prefer to receive this info if not through Skills Day? So I have the survey available from 4/8 to 4/21 of this year. And I had only about 42 colleagues complete the survey, so I was a little upset. I was hoping I would have more, but at the same time, I was happy with the number. So all submissions were anonymous, and questions 1 through 6 were yes or no. Yes or no answers, and then question 7, the question that said, you know, how would you want to receive this information if it wasn't through Skills Day? That was a text box so that they could freehand their text in there. Only 19 out of 42 of the people that answered the survey responded to this question. Everyone else skipped it. So my results from the survey. So 38 out of 42 colleagues found the biannual Skills Days beneficial. 38 out of 42 colleagues found the topics covered at Skills Days to be applicable to their practice. 38 out of 42 colleagues gained a better understanding of the topics that were covered at Skills Days. 38 out of 42 colleagues felt engaged at the stations. 40 out of 42 colleagues felt that their questions and concerns were answered, and 41 out of 42 felt that the information was presented in an adequate amount of time. So some feedback that I got from the colleagues. So this was that question number 7. So a lot of colleagues, you know, as you can see from the scores, you know, a lot of colleagues are happy with the way that we're doing the Skills Days. But one individual commented, I think it was perfect. Another commented, I like the way they do the individual stations with a group of students. Continue to do hands-on, CBL only are not effective. Staff just click through to complete it and get it off their list, and they do not retain. So I thought that was great reinforcement of the literature that I had found. So this is some further feedback. So this slide is kind of a little bit of the negative feedback that we got. So these are all direct quotes from the survey. So I prefer the old way we did Skills Day, where it was explained and demonstrated in a whole day of education away from the hospital where you had time to learn without being rushed through like cattle. I feel the topics were okay and probably beneficial for the newer nurses or floor nurses who don't see things all the time. There was a majority of things that didn't apply to my department. This person was shouting at us. So we had so many stations to go to. We had to wait for a station to open up. We sat through the whole session and then received every topic in a health stream and had to take the time to answer all those questions. Have it one way or the other, that was redundant and very time consuming. And then finally, I like the Skills Day, but it should probably be offered on more than 2 days, also maybe more than twice a year. So while these were some of like the more negative things that were given as feedback, but the first and the final comment, they both say that they still like the Skills Days, they just want us to do them in a different way. I don't know personally how I would feel about doing the Skills Days more than twice a year. I think that if we did them quarterly, we wouldn't see as good a compliance rate, and I just think that would be a little bit more difficult for people's work schedules and things like that.
Also, whoever made that comment said it was only 2 days, so maybe that's an opportunity to educate and advertise that it's actually 8, 10 days.
Correct. Yeah, so that's a great point that I didn't think of, but also, so you know, anyone in the HSHS divisions, they can go to Skills Days at any of those hospitals. So, you know, St. Elizabeth's employees can go to the ones in Greenville. They can go to Effingham, which I'm sure they don't want to drive that far, but those are options. So, so as I mentioned, several colleagues commented on other ways that they would like to receive the information as opposed to the Skills Days. So some of those were health streams, PowerPoints, in-services, staff meetings through video and through email. The overall impression, so overall the survey results show that the majority of individuals found the Skills Day beneficial, found the education presented to be consistent with their unit practice, gained a better understanding of the topics that were presented at Skills Days, felt engaged at the stations, and felt that their questions and concerns were addressed. So that was great. Skills Days remain to be the preferred method of learning amongst our colleagues. Only 10 out of the 42 individuals preferred a different method other than our Skills Days. So that provides that data that we're still gonna, continue to do skills days the way that we've been doing them. So I did identify a few limitations, and you can let me, feel free to add anything in if you felt like there was maybe something else. So the survey was not available to St. Joseph Breeze Hospital and to St. Elizabeth. I did that because we haven't done our skills days yet this year, and I didn't want previous experiences to kind of skew these results. So that's why I eliminated them from this. Only 28% of the colleagues who received the survey completed it, so that's, that was a big missed opportunity for the further insight from those colleagues. And then 45% of those 42 colleagues contributed additional input into how they would like to receive the information. So again, a missed opportunity for further insight. So just to kind of summarize the main points and come to a conclusion. So skills days are essential for ensuring competency of colleagues and continuing to improve patient safety. Skills days are helpful for leadership and educators, as a large amount of staff members can be educated in 1 day at one time. CBLs, although convenient and preferred by many colleagues, do not prove to be the most effective teaching method, as we've come to find. And other learning methods have been identified. However, skills days appear to continue to be the preferred method at HSHS. And I do believe that research on skills days should continue to be performed to reach other hospitals that were eliminated from this one and identify further strengths and areas for improvement. So my professor for this course reached out to me, and she's like, I think your project is great, and do you plan on going back for your master's? Because I have an idea of how you could continue this. So I'll probably be getting with her whenever I do one for my master's and seeing how we can expand this project. So those are my references. Any questions? Thoughts?
I think more than a question is just a comment that anytime we do SurveyMonkey or a paper survey, we usually get less than 30% participation.
Okay.
And then usually people that are more against something, so there's a little bit of participant bias, that they are more likely to fill it out if they're mad or disgruntled about something. So even though your return rate was low, I think the fact that it was mostly positive is very encouraging.
Yeah.
So I think that's, I think it's significant that it was so positive, because I find in our experiences with other projects like this, and anytime we use a SurveyMonkey as a hospital, the mad people are the ones that answer. So I thought that was encouraging.
Yeah.
And I thought you did a great job.
Thank you.
Over the course of your research regarding this topic, was there anything that you found that you thought would be beneficial as far as a change in the future?
So I found a lot of research. I had a little bit of difficulty finding a lot about actual skills days. I found a lot on unit-based competencies. So I feel like that's kind of what we're doing with like the ICU skills days and the ER skills days and things like that. There wasn't really anything else that stood out to me that I would think, oh, we should do this instead of skills days, because I agree with the research, with the literature, that health streams aren't effective. I mean, we all know that some of those are done within a minute, and those slides and PowerPoints and everything should be taking like 45 minutes to go through, and then taking the test adds that additional time. So I'm satisfied with the skills days.
So being now an educator versus a bedside nurse,
Mm-hmm.
and participating in the creation of these skills days, do you feel like there are some things that we shouldn't? Some of those little booths that we should not be having that are redundant, or that could there be something more impactful to put in place of any of those?
Not really that I can think of, at least not any that I can think of right now that we're currently doing. At first, when we're doing a station that's like Foley's and the PureWicks, which we don't have here, but those are the external female catheters, and CBI. So I thought that it was still beneficial to do that, because I know there's a lot of people that don't use CBI a lot, or are very uncertain about it, or unsure how to do it. So there's none right now that I can think of.
I think it would be interesting, I think that we noticed in skills days that back in the day when we did skills days, we'd have 40 stations. There was no way to retain all the information. So I think that we've noticed that having a smaller amount of topics seems to be more effective. But I would like to see the difference. I'd like to, maybe this could be part of your master's project.
Mm-hmm.
The stations where the colleagues have to be engaged in something like the mock code station or when we make them look things up on the computer. I would like to see if there was a better retention when they actually have hands-on versus informational stations. I know that when you ask them what they learned in the skills day, just anecdotally when you're talking to them, they remember the ones where they had to do something.
Yeah,
So I'd like to see how well they retain the information and how long, so.
yeah, I agree
Or
with
those
that.
little tidbits that like we knew, but you didn't know that one little piece of it. Like when I saw at the last one, when I saw that we were doing a presentation on our beds, and I just kind of thought, why are we doing this?
Mhm.
But I know safety but when they put that patient in between those two rails and stood them up, I was like, well, shut up. Like I don't do that.
Yeah.
So it's just those little things that make a huge difference.
I think that, you know how we're trialing the Alexa?
Yeah.
Is there a way to like go to Alexa and see which question people are asking Alexa the most?
Yes.
Oh, that's a
Because then we could base our skills days
That's a
possibly
fantastic
off
idea.
of what they're
Wait,
asking
let me
Alexa
write
the
that
most.
That's a fantastic idea.
That is a really good
Always
idea.
asking them what Matilda lost for.
Yeah.
For sure,
Yeah.
and that's a problem.
How long
but-
is a PR interval? Like things like
Right.
that.
Right.
Ooh, those are good questions. My questions are not right questions. I still need 2 questions.
I had help with my questions. I asked
We still need
some of the
31.
nurses.
We don't.
30.
I would like to see a better way of measuring competency after the fact. I think they are right, one of the feedback, now that must have been a person who went through the fall skills days, because we haven't released the CPL for the spring skills days yet. But I would like to see a better way of proving competency after the fact, other than making them go in and then view all of those individual questions and sign an attestation to every single station. I think that it's a little convoluted, and I don't know that it really, I think it checks a box for us, but I don't think it really.
That's all it is for,
I
because we
agree.
have to demonstrate competency from a joint commission perspective.
Yeah.
Right.
But I think what people actually retrain for their practice is way more important to us.
I agree.
But just like, we have to balance that with regulations, but just like the colleagues would prefer to maybe have a CBL because it's easy and quick,
Mhm.
we have to balance what they want with what's good for them.
Yeah.
So, and that competency verification is, I don't know that we see it as a real competency verification, because of course direct observation is best for that,
Mhm.
but we have to have a bookmark, have a check mark, as
Yeah.
Amanda said, so.
I kind of thought like we could make, before the person leaves the station, they have to do like a hands-on demo. So like for the port station, just for example, like you have to show me how to access the port, but that would just take a
Slow it
lot
down
of
and
time
then-
and,
Yeah.
But yeah,
yes.
you're right, that would be the best, that would, if we were able to do that. Very
Or
good.
have five of the bodies in a box to insert a
Yeah.
course, you know what I mean? Like
And watch
in
each
dream
and every
world.
single one of you.
Right, right. Like 5 BAMs all lined up, like everybody does CPR and we'll watch it.
For my doctoral project, one of my barriers I found was if people already decided this isn't important or my personal opinion is I don't want to do this because mine was about vaccines in pediatric patients, but then it didn't matter what you were educating on or how you were delivering the information. They had already decided I don't use that, so it didn't matter.
I think that's valid, because we have seen increased, as our colleague engagement and our nursing engagement goes up, we've seen increased participation in our educational events. So, and in nursing forums and in everything. So that attitude coming into it, I think that's very accurate, I would say.
Nobody has any other questions, and that's all I have. Thanks for coming.
Yeah,